Thanks, Margaret. Thanks, everyone, for coming. First, thanks, for Margaret Wong and for hosting this program. Great thanks for Margaret's staff and the CWRU staff for doing all the logistics in here. My name is George Kikano. I'm Vice Chair for Community Health and Chair of Family Medicine at Case Western Reserve. I'm really proud to be here. I'm going to be brief. Just we're doing so much around Cleveland. Case has done great. Education, research, most importantly in the past few years, my Dean Pam Davis had decided that we need to reach out to the community. Community defined as communities around us in here, both ethnic group, urban groups, whatever else happening in Cleveland and Northeast Ohio, but most importantly, a larger community in the world. Dr. Lilly, who's on my faculty, will speak in a few minutes. He'll tell you more of the content and the bulk of the program. Dr. Lee and I started going to China, mostly in Shanghai, for the past 7 years. What started as more of education giving conferences in China became at this point the full-fledged academic programs. Just to give you some examples, and Lee will go in more details with you. We started with just more what we call CME or teaching programs for physicians and graduate students in Shanghai, been going on now on a yearly basis for the past 6 years. In the past 3 years, we saw that large number of medical students coming to the medical school at Case, which is very competitive to get in, out of Asian origin. So we developed a relationship with one of the local medical school in China, and we have now medical students going back and forth. Last year we had slots for 4 medical students. We got 20 students from Case interested. As we speak here, we have 4 Chinese students in here. They're learning high-end robotic surgery. They're sitting up in a small classroom, different teaching model, didactic model that they're used to. And also we have 4 students as we speak now in China, getting exposure to the Eastern medicine, Western medicine, what's happening in China. Probably one of the most exciting things we've had is also a major research study. It took 5 years to design, to work out. This was done with just with time, effort, talent, with no actual funding. For people who know what the Framingham study is, Framingham is the study done in the US that tied cholesterol, smoking, high blood pressure to heart disease. Framingham had only 5,000 people in it. What we have in China, we have a study with 48,000 people. As of a year and a half ago, we signed an agreement with the Zhebai district to look at, name it, heart disease, cancer, diabetes, obesity, genetic diseases. So we have what we call a cohort, so we have 48,000 people with a commitment to follow them up till 2020, so it's called Shanghai 2020. On 23,000 of these people, we have actual serum samples, we have DNA. So my example I use, if we have a child that develops leukemia in 4 or 5 years, we can go back and look at the genes now, compare it to what happens 4 or 5 years from now. We can look at people, becoming obese, people becoming diabetic, people having heart disease. To do such a research study in the US, it will cost hundreds of millions of dollars. It will take hundreds of people to do. We've done this very successfully with our Chinese partners. So Dr. Lee and myself and Doug go at least there once or twice a year. So we're doing research, we're doing public health programs, we're doing the medical student exchange. So this is really, a full-fledged academic program that we've done, just in good faith, partnership between the School of Medicine at Case, as well as our Chinese partners over there. One of the byproducts of this, on a trip a year and a half or 2 ago, Dr. Lee said we need to identify talent at the graduate level. We have great research happening at the School of Medicine. There's great scientists happening in China. How can we make my story there? Literally, Lee and I were in some small restaurant in, can't remember even where, in Wanzhou actually. We got this young kid who took a train for 5 hours in the evening. She brought her laptop just to give us a half-an-hour presentation about her research study. I said, wow, this one, this is somebody who has research potential, scientific potential. How can we get her to Cleveland? Literally, as soon as I get back, I spoke with my dean, spoke with some research, was one of our department chair in basic sciences. Before we knew it, Yan now is getting a PhD at Case Western Reserve. Literally, she took a train ride, presented, spoke good English, had good science. This was good talent identified, literally in a small restaurant in China, and she's at Case getting her PhD. So where's Yan? Yeah, here you are. Yeah, so I'm going to turn over the podium just a minute, have Yan tell your story, and maybe Dr. Lee will tell you more content about more research, education, and public health we're doing. We're so excited about this. This just shows commitment, how we are doing. We also have medical students. I was at the White Coat ceremony, which is the first event that medical students have. I was looking at the names on Sunday of 200 students just joined Case Western Reserve. I saw so many Asian names. My family said, commented, wow, these kids should be smart, competitive to be able to get to Case. I think we have at least one student here. So Yan Yan, it's yours, and Dr. Lee will tell you more about the program. Thank you all for coming.